Dr. JeanAnne Johnson is a nurse practitioner with a doctorate in neuropsychology. She is a board certified in family practice, psychiatry, addiction medicine, pediatric mental health, and is a certified autism spectrum disorder clinical specialist. She is currently completing 2 fellowships in functional medicine psychiatry. She is the medical director of Harper Clinic, an outpatient facility in Orem that uses functional medicine, genetics, nutrition, and lifestyle to address the whole body and individual's mental health treatment. We want to welcome you, Dr. JeanAnne Johnson, to the podcast today.
So this is, they can listen to this on regular podcast or they can see it on YouTube. So
Great.
They can see our smiling faces. So this was your first year being involved in the Be Healthy Utah conference. So you got to speak there. How was that? How did you enjoy that?
Yeah, I really enjoyed that conference. I was actually surprised at how many vendors and booths were there, and the amount of just how popular being healthy was. You know, it made it feel like it wasn't.
You felt at home, huh?
Yeah.
I know it's really cool. It's a cool event where it allows just so many different and if it was the first time going, if you walked up and down the aisles, you're like, holy cow, there's so many different things. Yeah. That's what's so cool about it. Yeah, it's a lot of work for us to put on, but we are so grateful for the Harper Clinic. They were one of our sponsors as well, so we very much appreciate that. So tell us a little bit about you and your background and how you got into this.
Yeah, so I have been a family nurse practitioner for a really, really long time, almost 30 years, and a psychiatric nurse practitioner for now about 14 years. So have been doing a little bit of both. One of the things that I've realized though over the years is that a lot of my patients are coming back. Depression, anxiety, the symptoms, they might get a little bit better, but they relapse, I guess. They come back. And I've just gotten to the point where, what am I doing wrong? Or is there a different approach I can take for my patients? And got more involved in the functional psychiatry aspect, looking more at just the symptoms of the patient and kind of investigating, what else is going on? Are there stressors at home? What kind of environment is the person living in? Do they have genetic predispositions? What kind of diet are they eating? Are they getting any exercise? And so I've been really fortunate at the Harper Clinic to be able to put those modalities into practice. And
so when you did, because 30 years you've been doing this for a while, and you've probably seen your licensure be able to expand quite a bit. Because 30 years ago you weren't able to do probably nearly as much as you're able to do now, correct?
Well, I started in Washington, D.C., and so that was, at that point, completely independent. So
okay, because I know that's just recently only been, the last 4 or 5 years here in Utah, right? Where nurse practitioners can independently do all the stuff that they're doing, if I recall correctly. Because I had a nurse practitioner about 4 or 5 years ago in my office, and some of the stuff that we were doing. And I know their licensure had changed, so they were able to now do a lot more things without having to have a medical doctor, oversee some stuff.
And it might have to do with how long you've been licensed. Because I moved to Utah about 17 years ago, and since being here, I've been completely independent. So, I do have a couple of other degrees. I have 2 doctorates and actually 3 doctorates, but
who's counting?
Who's counting? No. And so that with, I think, the background maybe and the licensure that I had in Washington, D.C. and then in Colorado, which were both independent practice states.
So are you just you just punish yourself with going back to school, or what?
I sure do. That's kind of people make fun of me,
Yeah, that doesn't even sound fun. But you know what? You're helping and benefiting your patients, right?
So I wanted to ask you, because functional health, it's like when you get into, it's different. It's a different mindset than regular, than the medical model. So what happened with you, or how did you decide that you wanted to start to go that functional health route?
Well, I think, like I said, people were coming back and maybe they got better for a little while, or they were tired of being on antidepressants, for example, or they were having side effects. Oftentimes I hear about the side effects of antidepressants, and just like, is there another approach? Can we do this a little bit differently? And as I got into some training, I found that, some people think, oh, that's just woo-woo, foo-foo medicine, but it's actually evidence-based, and there's a lot of science behind it. And since I've been practicing, I've seen a lot of improvement in patients. So I really believe in it.
Well, the old woo-woo and foo-foo is now becoming more popular, right?
It sure is, yeah.
I mean, it is. It's like a lot of, people are, I think COVID really changed things. So our first conference was in 2019, and then we got hit with COVID for a couple of years and weren't able to do the conference. And the next time we were able to do it was in 2022. And it exponentially grew. And I think a lot of it was because people decided, you know what, I've got to take my health into my own hands. I can't just listen to what the experts say or what science says, because science right now is bought and paid for. 100%, and so it made people start looking for other things, and then they're also saying, well, you know what, I need to do things. I can't just go to the doctor and say, hey, give me a prescription and I'm going to be better, and that's all there is to it, because it's not. There's more to it. And like what you're seeing, you said people are coming back to depression and stuff, and people are never even putting the gut-brain connection into that, the food they're eating into that, just doing exercise and just stuff like that is, can be very, very beneficial for these patients.
Yeah, and there's a lot of older research that shows that when people would go to the doctor and leave without something in their hand, usually a prescription, they didn't feel like they were getting any treatment.
Right, they didn't think they got their money's worth, so they would go down the street to the next guy that would, right?
And get me a prescription. And so for so long, the thought was good medicine or good treatment is walking out with a prescription. And I think we're realizing, no, we can do so much better than just handing you a prescription for something that might actually do more harm than good.
So you're into functional psychiatry, right?
Mm-hmm.
So, because a psychiatrist is someone who can actually prescribe medication. A psychologist is somebody that cannot. They just are talk therapists, right? So
there are some states that allow psychologists to prescribe, but...
Oh, okay. But that's kind of how you differentiate the two.
Yeah.
So when you first started out, were you more prescription-based and kind of just following that same model? And
I sure was, yeah.
So now, what are some of the things that you do that are drastically different now for your patients versus what your old school thought was?
Yeah, that's kind of funny that you even asked that too, because for several years I was a national speaker on psychopharmacology, so on medications for treating these. I mean, I've been all over the country.
So you know the ins and outs of all these drugs.
Yeah, and I was kind of like the expert in writing the prescriptions. And then I think, like you said, COVID changed a lot, and I stopped traveling. And as I did less and less traveling, then a lot of, like what you said, got more involved in, what can we do for our health besides the prescriptions. So now I'm looking at way more than just writing a prescription. We're looking at lifestyle and the food and the sleep and environment, a lot more testing. I never did testing on my patients who came in for depression. I never said, let's go get some labs on you. So
what kind of testing, let's go through that for just a little bit so people can understand what makes you guys a little bit different. What kind of testing are you looking at doing, or what are you doing?
Yeah, so I call it a comprehensive workup. Basically, I do the general testing, which looks at your blood cells, your white blood cells, red blood cells for anemia. We're looking at kidney function, liver function. We're also looking at inflammation. So any kind of inflammatory markers. I look at nutrient status, so some vitamin levels, vitamin D, vitamin B12, folate, B6, things like that. look at omega-3s. Those are your healthy fats that are really critical for brain structure. Cortisol, hormonal testing, insulin levels. We can do even more functional tests. So those are the ones that I send you to the lab, and it's blood work. And then we can also do some more functional testing, looking at the gut, maybe the gut health, looking at the microbiome. We can do food sensitivity. So a lot more inflammatory markers.
Mm-hmm. Yeah.
So what have you found by looking at these tests that you've seen a correlation with people that are struggling with mental health problems?
Yeah, this one has really shocked me. Is I would say probably about 90% of my patients that I order testing on come back with low vitamin D. And I'll have people who tell me I work outside or I'm in the sun a lot, and I'm still seeing really frequently low vitamin Ds. And that's linked to depression, anxiety, fatigue. So that one has been a big one for me. Looking at insulin resistance, a lot of people come in and say, I'm not able to lose the weight I've gained weight and I can't get it off, and I don't know if that's part of my depression or anxiety. So we look at insulin resistance. It's been pretty helpful. I did have one patient who has struggled for many years with depression, has tried all kinds of different medications and different modalities, and we found that he had insulin resistance. He didn't really have a weight issue, but the insulin resistance caused him to not produce his testosterone. And so his testosterone levels were so low that he was having the symptoms of depression, fatigue, no motivation, and rather than just even give him an antidepressant or even give him testosterone, we fixed his insulin resistance. So then he started creating his own testosterone again, and his mood improved and his energy improved.
That's actually a national issue right now, that in the functional world, that in the medical model they're like, oh, it's okay that the men's testosterone is down 400 or 500 points in the last 50 years. It's no big deal, right? But I mean, that's a huge thing, right? That's a very big thing. What in your thought process, what do you think is one of the biggest key factors for that?
For the testosterone?
Yeah, being so low in so many men. I mean, it's now common. I mean, 300 is like the low for normal, and 300, I mean, 700 should, 50 years ago was the low, right?
Right. I think there are several factors. The diet is a big thing. We're not getting the appropriate nutrition, and we're not having the mitochondria health that we need. So the kind of the energy producers in the cells. We're seeing that there's hormones in food, changes in hormones from the food, and then there's the whole concept of that allostatic load, which is the wear and tear in our bodies over time by chronic stress. And we do see a lot more stress, which is increasing cortisol levels and decreasing other hormones such as testosterone. And just giving a testosterone injection every week is not fixing the problem, right? That's not the person's own testosterone. They're not making it. So if we can find out what's going on, why they aren't making it. And there's side effects, and there's long-term effects from giving somebody testosterone injections every week. So
yeah, there definitely can be.
So what about we talked a little bit about testosterone with men. What about women? Because I know there's going to be a lot of women on this. What have you seen that have been correlated with the mental health and the testing that you're seeing?
Yeah. It's interesting. Women are getting diagnosed with depression and anxiety at twice the rate as men, and are getting about twice the number of antidepressant prescriptions. So it's a big issue in women. Lots of hormonal changes, just like we just talked about with the men and testosterone, and imbalances in hormones in women. Even testosterone in women can change or affect their mood, motivation, anxiety, sex drive, libido. So seeing a lot of people coming in, and it's hormonal.
When is it that you're starting, are you seeing it earlier? And then, or what is the ages that you're starting to see the biggest spike that women are struggling with?
Well, young, very young. So, if aside from hormonal changes, just in general with mental health, suicide is the second leading cause of death in our adolescents, our teenagers. So ages 12 to 17, second leading cause of death. We saw, I think it was like 130% increase in diagnosis of anxiety and depression, and the prescriptions for antidepressants and those types of medications in our female population and in the young female population. So it's a huge problem.
Do you attest that to? I mean, it's almost become just a buzzword to me. The way I look at some things, it's like, oh, I get so much anxiety about it. But do you think it's become so popular that people are just kind of using that as an excuse, or do you think that it really is a legit thing that these people are having? I mean, I think it can be both ways. But do you understand my question in that aspect?
Yeah, I do. I've seen it both ways too. I've seen, you're like you said, it's a buzzword. Ugh, I have so much anxiety surrounding this. And I've had people, when I've been doing presentations before, I've had people stand up and say, this wasn't an issue when I was young.
Right.
We were told just pull up your book.
Exactly. If we were gone from home from school, or like, I use the example of when people go out on missions, they're gone for, we just called it homesick, but now it's like everyone's got anxiety and they're having issues and they are having a hard time dealing with different things.
Yeah, like I said, I think it's both. I think we're more tolerant, or we're more accepting of people saying I have anxiety, I'm anxious. But I also think that we have more contributing factors. Mm-hmm. Social media, right. Electronics, sleep habits are different. The diets are different. We're not making food at home anymore. We're not eating a lot of fresh food. We're going out and we're getting so much processed food. So there's both.
Right. Yeah, we interviewed a guy yesterday, and he was on a raw diet for 8 years. He'd done a raw. He wasn't still on it, but he had in his past he did a raw diet for 8 years. It's like, that's impressive. That's
dedication. That's for sure.
That's massive dedication. For
yeah.
sure.
So what are some things that we can incorporate into everyone can incorporate into their lifestyle to be able to have them have a better mental health and clarity, and so we don't have to have those dips of depression?
Yeah. And I think that I get that from a lot of people. What are things I can do? My insurance doesn't cover that functional stuff, so I'm not going to come to you. I can't afford to pay for it. Well, there's a lot of things we can do that are absolutely free. Getting a good night's sleep, having good sleep hygiene, 8 hours of sleep, going to bed at the same time. That's free. Getting up and moving, whether it's taking a walk around your living room or around the block, movement as much as you can. Having healthy relationships has shown to decrease anxiety and depression. So somebody that you can call on the phone, spend time with, laugh with, have a good conversation, getting outside, putting your feet in the grass barefoot,
getting grounded.
Mm-hmm. Those are all free things, and then eating a better diet, so less processed foods. I'm not saying necessarily a raw diet, especially for 8 years, that's a long time, but being just more aware of what we're putting in our mouths and trying to decrease some of those processed foods.
Just a simple thing, if you have a meal and then you just go walk around the block right after that meal, your insulin levels are not going to do the same thing as if you just go sit on the couch and watch TV, right? It's going to, and so just little things like that, because you had mentioned how insulin levels, you talked about that, how that helps hormones and different things like that, and affects how it can affect that. So it's just, sometimes we just have to make lifestyle changes. We have to get off, and we've become such a sedentary, like people will go to the gym, but then they'll go to their job job and they'll sit for 8 hours at the computer doing their job because that's what their job is. They'll get up to go to the bathroom, they'll get up for a 5-minute break here and there, but we just have our lifestyles are so drastically different, than what they were 50, 100 years ago. We're not out in the fields planting them, and that's what we used. That's what we planted. What we ate what we planted, and we were always out, and we're out in the sun. And it's like, to me, it's always funny. It's like, these people were out in the sun all the time. How come they weren't? Why is the sun now more dangerous? It's not. It's just the things that have happened, right? Mm-hmm. And so vitamin D levels are down because people have been told they need to, cover up. You're out in the sun. You need to put all this, toxic sunscreen on and all those kinds of things. It's really crazy. So if they do change, just little things. So some of those things are like what you were talking about, right? So what got you? I have a question on. Did you see just a lot of drastic issues with some of the medications you were giving and stuff like that? Is that kind of what made you kind of switch your thought process on the going functional versus standard?
Yeah, one of the questions that I would get a lot of the times was, well, how do you pick an antidepressant or a medication? And that's a great question. And sometimes I would say, I should have gone into orthopedics or something where you could take an x-ray, you saw it was broken.
Right.
You fix the break. Unfortunately, in psychiatry, it's and I don't want to use, I'm going to say it, it's sometimes it feels like a crapshoot. It's like, where am I throwing the dart? At which symptom? And the studies really have shown that only about 1 in 3 people, so 1/3 of the population who gets put on an antidepressant is going to even benefit from that. And then the rest of them are going to have to try several different medications, so changes, trial and error, adding on more medications. And then we're seeing the side effects, whether it's
some of the side effects are suicide, right? I mean, that's kind of a crazy side effect when you're taking a drug for depression, and the side effect for the drug is suicide. Yeah. It's like, those don't work. Yeah.
Yeah, and yeah, I think it was just getting a little kind of depressing to myself. Like, oh my goodness, I've tried you on all these medications, you're not getting better. The other issue is access. Often prior to working at the Harper Clinic, I was getting 15-20 minute appointments with people, and that's not enough time to go through what are you eating, how much are you sleeping, what are you doing all day, what makes you happy, what do you find joy in. It was, again, the writing of the prescription. And
were you in a hospital setting? Were you in that kind of a setting previously?
Yeah, I've worked in several different settings. I've done outpatient clinics, and I've worked in the hospital, and I've also worked at residential treatment centers. So yeah, but again, I think I looked the other day what the wait time in Utah is for an appointment with a mental health professional, and it's like 2 months. For kids, you're looking at 3 to 6 months. So if somebody is struggling with one of these illnesses, it's really terrible that they have to wait months to get an appointment.
Well, and you see with it is a big, huge epidemic with these kids, and I really think that the whole COVID thing that they did have to experience, we have kids that were graduating at the time, and these teenagers that we had some in elementary, some middle school, some high school, and it really affected them. But one thing during that whole time is that we try to not make it was a scary environment for them. We tried to be outside a lot.
We were the people that were doing what we weren't supposed to be doing.
Yeah.
Like, don't wear your mask. We don't care if you wear your mask. Anyone in the neighborhood that wanted to come over to the house, you're free to come over to the house. Because it's like, it's just craziness, right?
And so I do think by keeping a normal kind of routine for these kids during that time, we were able to make it so it wasn't so hard for them. But even with doing that, it was still a struggle. And I know that it is a huge epidemic out there that we don't even know the ramifications that's going to happen. But people did start to wake up for it. They are starting to look at these natural ways that they can become healthier. that they can become, help with their mental. I mean, with people now trying, the meditation and the yoga and all of these different things. If you see people out grounding now, you don't think that they're as crazy anymore.
Yeah, exactly.
And so that is a good benefit, is that people now have had to really start to step up their game, and these teenagers that were going through that whole, now they're young adults, and now they're starting to have children of their own. And so hopefully this next generation will start to realize the importance of that. It's not about the medication, but it's about how you can take care of yourself in a natural way.
Yeah. And certainly there are medications that have been life-changing for people, so I don't want to sound like I'm a completely anti-medication, but I think that's only one piece of the puzzle. But yeah, with the COVID, I feel really fortunate to have been in Utah. I felt like Utah addressed the COVID a little bit different than other parts of the country. My sister is in the East Coast, and she and her son came out and stayed with me during COVID because we were still getting out. Yeah. And he was able to do some baseball and things, and it wasn't so isolating. So I think in other parts of the country, it's much worse than even what we're seeing here in Utah, because they were so isolated. And a friend of mine who lived in New York didn't leave his apartment in New York for 2 months. Didn't leave his apartment.
Well, and if you see all of the things that we were asked to do, that was a storm of things that are going to affect us mentally. Staying inside, we need to be outside. That is where we're getting our vitamin D, right? We are social human beings. We need to be around other people. We need to learn how to communicate. Instead, a lot of us started to get drawn in, and we started to text more, and we started, to not have that contact. Yeah. And then, the foods, and, probably not wanting to, be outside and gardening and, all that type of stuff. And it was just kind of like a storm of bringing it all together to create mental illness. And so if we look at that, we start thinking, okay, what are the opposite things that I can do to start incorporate? Be outside, be around people, start, to look at food as our medicine, and, just all of these different things to really, that's the foundation of our mental health. And yes, there are exceptions to the rule, and I know that there are people that struggle a lot with mental illness, and, medication, if it comes down to it, that might be the option, at least until you can get them on the track.
And that's one thing, as you said, you spoke nationally on for some of these pharmaceuticals and stuff like that, right? But it's my understanding that none of these medications were ever meant to be long-term. Am I correct in that? My understanding is that most of them were never studied in their trials for longer than, a short time. And yet these people are on these prescriptions for years and years and years. Is that your same understanding since you were in that world?
Well, yeah, I think that the majority of the studies were over a period of 12 weeks, looking at efficacy,
Yeah.
Certainly then if they weren't effective, then they might move on to another one for 12 weeks. And then, and then there's a lot of studies of how long should a person be on the antidepressant or the medication for depression, for example. It's kind of like a 6 to 12 months, you're doing really well. Okay, let's get you off. Doesn't necessarily mean you should be on it all your life. When we're talking about some of these medications that are prescribed for anxiety, benzodiazepines in particular, those are really short-term, once in a while. Those are not to be taken every single day for years and years and years.
But sadly, they happen, right?
Yeah. Oh, yeah.
It's craziness. I mean, like your Xanax. What is and I can't remember the popular drug that was for depression. People were on that for years and years and years. It's like that drug was never meant to be that way. And yet it's just such an easier thing. Just, here, we'll just refill your prescription. We'll just refill your prescription instead of actually educating and trying to. And honestly, most of those doctors, let's be honest, most of those psychiatrists, most of those family medical doctors, they don't know any different. They just know the world of pharmaceuticals.
And I think up to 80% of these medications that are psychiatric medications are prescribed by non-psychiatric trained providers. So
wow, okay. Because they are the family doctor. They are their regular.
The family doctor, whether that's an access, I tried to get a psychiatric appointment, it's months out, but you're my family doctor, I can see you tomorrow or next week.
And family doctors were happy, just say, oh, Zoloft, I've heard that's good. Which TV commercial did you see? And I'll give you that one.
Yes, ask your doctor about,
So when people come into your clinic, then what can they decide, okay, you know what, I want to get off the regular prescription drugs and go this natural route. What is the process for them getting off that to coming to trying the natural route?
Yeah, I tend to taper people off their antidepressants rather than saying you can just stop them abruptly.
Right, because that's dangerous as well. If they've been on it for a while, it can be very dangerous.
Yeah. So we taper off the antidepressants, but at the same time, maybe do some lab work, some testing, see if there are other underlying problems. Do a deep dive into the food. How much sleep are you getting? How much water are you drinking? 100%, I should say. I shouldn't say 100, but a lot. The majority aren't drinking enough water. Even who I'm trying to drink more water. We say 50% of your body weight in ounces. So, not very many people are drinking that much water. So we start with the other more functional approaches while tapering off the antidepressant, seeing how their mood is responding.
So what are some of the treatments? Because don't you guys, if I recall, you guys do TMS as well?
Yeah. So
do you want to take just a quick second and kind of explain that and how that can be beneficial? Because that's natural approach.
Yeah, so TMS stands for transmagnet stimulation, sorry. Yeah. And essentially what it is it's a magnet that's kind of waking up that part of the brain.
Parietal lobe, is that right?
Yeah, and we have it for OCD, we have it for depression. Those are both FDA approved. There's some other FDA approvals that are in place looking at maybe ADHD, even migraines. So
isn't addiction one of them as well?
Addiction,
can that be used for addiction?
Smoking cessation is one too. Yeah. So it's kind of a magnetic pulse and lasts about 20 minutes every day. We recommend the protocol is every day for about 36 sessions, 5 days a week. And so we've seen some pretty good response to TMS.
What are some other treatments that you're doing besides just the protocols of taking it, changing their diet and stuff? Other treatments that you're doing that also include, what are some things that
we have therapists, a lot of people say, well, I don't really like talk therapy. Well, yeah, it's talk therapy, but we have some other modalities such as accelerated resolution therapy, which is a pretty quick trauma therapy. EMDR is another one that we've used. And then we have some breath work classes, so holistic breath work. Sound bath is another one that we offer. We have a massage therapist as well, so even just some body work. We do offer ketamine treatment. Our ketamine treatment is a little different, I think, than some of the other ketamine facilities around. We use a fairly low dose of ketamine because our goal is not necessarily to get you to have a trip or to have some psychedelic experience. The research has shown that just the ketamine itself without the psychedelic experience can improve the neural pathways in the brain. And so we do a ketamine experience. We have a therapist on hand, so if there are any things that come up, we don't just put you in a room, give you a shot of ketamine, and then come back in 30 minutes and say, okay, it's time for you to leave. We have a nurse and we have a therapist there that can help process, and we either provide a therapy session within 24 to 48 hours, or if somebody has their own therapist, we highly recommend that.
So there is one of the reasons why we started the Be Healthy Utah conference was because people didn't know where to go to get natural help, and they're looking for clinics that are like yours. They want to be able to, they want to have, like, they just don't know where to go.
They didn't know where their options were.
Yeah, they don't know where their options are. They don't know where to go. They don't know who to trust. So that is why we like to have people like you and others on the podcast so that people can understand where
and as speakers at the conference and being at the conference and everything like that.
Be able to help educate. So where is it that people can find your office at? And can you tell us a little bit about your office and where it's at and the website and all that stuff so that they can get in contact with you?
Yeah. So we're in Orem. We're just right off the freeway on 1600 North. So, I mean, it's right as you're driving up the freeway on 1600 North. We're just right on the east side. The office, another thing I didn't mention is we also offer IV therapy, so IV nutrients, vitamins, and minerals that we can provide. So the office has a big kind of yoga room. So we have yoga, we do the breath work there, we do some meditation, we have the massage room, the TMS room, an IV therapy room. Therapists are there. And our website is harperclinicutah.com. And we're also on some social media, Harper Clinic Utah. Yeah.
And it also shows here that for anybody that comes in, they can get a $30 credit towards if they mention our podcast, they get $30 credit towards at the supplements, right?
Yeah.
Is it the supplements at the clinic there?
Yeah.
So everybody take advantage of that because that is great. You can probably try some things that you probably sell good quality stuff there, that a variety of stuff that, because sometimes you don't know the supplements that you get. So it's always good to be able to get it at a natural health clinic.
Well, I think that came up earlier with some of the products that you can buy over the counter. There's all, if I say go buy a vitamin D product, going over to your pharmacy or grocery store and picking up a vitamin D supplement may not necessarily have vitamin D in it. So those supplements are not monitored by FDA, regulated. And so some of those supplement companies can just put out a sugar pill, or it could be nothing, and then it's labeled as vitamin D. So we use products that are third-party tested, meaning that there has been an outside party that has gone and looked at the supplement companies and found that, yes, what's in their products is really what it's supposed to be, or what's labeled as.
Well, and you can also find this with the lab when you get your labs done, because I know with me, I had low vitamin D, low omegas and stuff like that. I started to be really good taking them every day, and I'm actually surprised at how much my vitamin D raised because I was taking a good quality vitamin D and I was consistent with it. Yeah. And like you talked about just a little bit, how important that vitamin D is to help you to not be sick. And also mental health, right? And so there's just a lot of stuff. And so you want to be able to take these good quality supplements, and most of the time you're going to find it in your labs if you take a before and after lab.
Yep. Yeah.
All right. Well, we want to thank you for being on the podcast with us today. Mental health it's such a buzzword in the last little bit. It's kind of interesting in running the conference. We have so many people that I want to speak on mindfulness. I want to do this on mindfulness. Like we have 50 million people doing mindfulness and things of that nature. But it's definitely become where people are very much in the thought of their mental health. It's like when people have to take a mental health day, that was never a thing several years ago, right? So, but it is. And for some people, there's drastic struggles. I've had some family members that have had real issues with depression and things like that. And if you don't have that, you don't understand it. It's like any issue, right? If you're skinny, you don't understand people that are overweight, why they can't just get skinny, right? I mean, there's lots of things, we just don't understand it. And so it's nice to have clinics such as yourself that are taking a different approach and want to help people, but are trying to do it in a more natural way so that they aren't not just, pounding, the pharmaceuticals.
Yeah. Thanks for having me. I appreciate it.
Well, it was nice having you, and thank you for coming on, and go take advantage of that $30 off your supplement.
Yeah. And if you have any questions, reach out so you can get a consultation and see what the Harper Clinic can do for you.
Thanks. Yeah.
All right.
Thank you so much. See you later.